Okay, we are up on the hill now, and I think people can see that behind us is the Medical Center Hospital of Vermont, and over there on the left is the University of Vermont. And during the course of this last year, there has been a whole lot of discussion, as I think many viewers know, regarding the relationship of the Medical Center Hospital of Vermont to the city of Burlington. I want to capsulize some of the issues there. They fall basically into two separate categories. The issue that we dwelt on most this year was the relationship from a taxation point of view of the medical center to the city of Burlington. The history of that is that during the last 5 or 6 years, the city has, on repeated occasions, asked the medical center to provide some financial help in one way or another to the city. The medical center is a very, very large institution owning substantial amount of property, having a budget of approximately $120 million a year. In terms of its financial contribution to the city for the services that it receives, the city receives $0, not 1 cent. And over the last 5 or 6 years, there's been a lot of discussion, and essentially the city has gotten no place. As a result of a recent Supreme Court decision dealing with a medical facility in central Vermont, the city attorney's office in Burlington felt that it was appropriate and right that the city, in fact, do away with the tax-exempt status of the medical center and, in fact, send them a full tax bill. And the tax bill amounted to some $2.8 million. The medical center opposed that, felt that what we were doing was illegal, took us to Superior Court. There was a very interesting trial that lasted for about 1 week. Superior Court Judge Meeker made a decision in which he essentially bought the entire line from the hospital, ruled in favor of the hospital, and we are now going to the Supreme Court. This issue of tax-exempt hospitals, nonprofit hospitals, is an issue not only of active debate here in the state of Vermont, it is an issue that's being discussed all over the United States now, and in fact in the United States Congress. It is very possible, not yet certain, but very possible that the arguments before the Supreme Court of the state of Vermont in this coming year will be of absolute national significance. In fact, that based on the decision of the Supreme Court, decisions will be made all over the United States of America as to how municipalities deal with tax-exempt hospitals. In a nutshell, what are the issues? To my mind, the heart of the issue is this institution really a charitable institution which deserves the subsidization, from the taxpayers of the city of Burlington? And my answer is, from the bottom of my heart, is that it is not a charitable institution. You have an institution which is headed by executives who make very high salaries, no different than salaries being made by other corporate executives. You have physicians who work here who are earning, in some instances, I suspect, hundreds and hundreds of thousands of dollars in income. You have an institution in terms of its relationship to poor people, which in fact provides very little help to poor people. About 1.5% of the total budget of the medical center goes to helping poor people in terms of free care. That, in fact, is not a lot. When Mary Fletcher originally founded the Mary Fletcher Hospital 100 years ago, she was very clear that she believed that that hospital should be providing, to as great a degree as possible, free care to the poor, and those people didn't have a lot of money. And for many years, in the early part of this hospital's history, 50%, 60% of the care that was being provided at the hospital was free. Doctors work for free. That has radically changed now. And I think what you're looking at is, in fact, an institution which, in my view, is a very good institution. It's a very good hospital. And we're delighted and proud to have an institution of that quality here. But if we look at it from the point of view of whether or not it is a charitable institution which deserves the subsidy that it is presently receiving from the people of the city, the answer to my mind is absolutely not. Now, another issue that concerns me, and concerns many people in the state of Vermont, is that what you're looking at here is clearly not a Burlington institution. No argument about that. What you have is a statewide facility. It's a facility being used by people from New York State. In fact, more people, I believe, or an equal amount of people from New York State use this institution as from the city of Burlington? Why should one community alone be asked to subsidize it and not the general region? And that's an issue that the legislature will be dealing with. Furthermore, in terms of this particular institution, I have two other additional concerns which have been raised during the course of the year and which I expect will also be discussed by the legislature. Number one is that the decisions, the basic decisions as to the priorities of this hospital, how are they going to be spending their money? Should more of their money go to the Visiting Nurses Association, which is now affiliated with the medical center, or should more of the money go into other types of programs? Who makes those decisions in terms of expenditures? Well, the Board of Trustees makes those decisions. Well, then the next obvious question is, who are the Board of Trustees? Well, the Board of Trustees are basically some of the wealthiest and most powerful people in our community. Do they necessarily reflect the interest of elderly people, working people, poor people who are having an increasingly difficult time paying their health care bills? The answer is, I don't think so. What you have now is a self-perpetuating body where they keep appointing people of their own like, and I think that that's a real problem. There will be a bill in the legislature which will ask that the governor of the state of Vermont sit on that Board of Trustees, and I think that that's appropriate, that we have representation from senior citizen groups, that we have representation from the host community. And I think that's a concept that should go on all over the state of Vermont. It is not enough for just a small group of people to be sitting on the Board of Trustees making those decisions. Second of all, right now, if you, a member of the public, wanted to sit in on a Board of Trustees meeting and hear what the discussion was about, and maybe add your 2 cents as to what you thought the priorities are of this hospital. And the reason that that issue is important is that most of the money that we spend in terms of health care, and we're conscious of the cost of health care because it's zooming upward, most of the money is spent in hospitals. This is the largest hospital in the state of Vermont. Approximately 40% of the revenue spent in health care in the state of Vermont is spent right here. They make decisions which affect us all. It seems to me clearly that their board meetings have got to be open to the public. Right now, they are not. They can shut the door. The media can't come in. The newspapers, television can't come in. The general public can't come in. There will be a bill in the legislature now authorizing that any tax-exempt hospital now have an open-door policy where people can observe the discussions that are taking place. So the whole issue of taxation and how the hospital is being run is very, very important. It's been an issue of significant debate and discussion this last year, will be next year as the case goes to the Supreme Court. The other issue, of course, relevant to this hospital and to all the hospitals and all the physicians in the state of Vermont is the whole issue of affordable health care. In my view, the whole issue of health care in America is perhaps the single most important domestic issue that we've got to deal with. We have a crisis situation. We are one of 2 nations in the industrialized world that does not have a national health care system, which says to all of its people that because you're an American or because you're a citizen of this country, you are entitled to quality health care because you're a citizen. To a large degree in our country, health care is still being run as a business. If you got the money, you're going to have the best health care perhaps available in the world. If you don't have the money, if you're one of the 15% of the population now that cannot afford any health care insurance whatsoever, you're up the creek. Because if you get sick and you end up there, you're going to be paying off that bill for years and years and years to come. And if you're one of the many people who do have health insurance, you have Blue Cross Blue Shield, you're noticing that the cost of your health insurance is zooming upward. Ultimately, in the next couple of years, there is going to be a debate in this country as to whether health care is a right of all of its people because of citizenship, or whether in fact it's a privilege that it can primarily be enjoyed by the wealthiest people. That will be an enormous debate. I intend to play a role in it because I believe that we need a national health care system to be financed not from Blue Cross Blue Shield revenues, not from Connecticut General, not from Medicaid, not from Medicare, not from out-of-pocket expenses, but ultimately to say that in this country we've got to join the rest of the world, say that health care is a right, that it's going to be paid for out of progressive national tax sources. We're a wealthy country. And I think if we have a nationally funded health care system, ultimately we will be spending less money than we are right now. For example, in Canada, which has a national health care system, the cost of the health care inflation rate is much less than it is here in the United States. And that's because they have one source of funding, where the government can sit down with the medical establishment and say, hey, you can't be raising your rate significantly higher than the cost of inflation. That is not the case here in the United States. Doctors' bills are going up, hospital bills are going up, It's an issue that's going to need a lot of discussion. We don't have to do it the way Canada does. We should do it our own unique way to deal with our own unique circumstances. But we've got to deal with that issue. So those are the two issues that will be, I think, continuously discussed during the next couple of years. Number one, tax-exempt hospitals in terms of their relationships to local communities. Should the local community be obliged to subsidize it? And number two, the more general question in terms of affordable health care in the United States of America and in Vermont. How do we have a health care system that all people can participate in without worrying about, bankrupting their families in the event of a serious illness? Those are the two issues. We've made a good start this year. I think a lot of people are thinking about those issues. There'll be a lot more discussion during the coming years.